Hello, my name is Dr. Monica Queen. I'm an assistant professor in the Doctor of Physical Therapy program in ASHES on the ATSU Mesa campus. Today I'm going to talk about From Classroom to Clinic, student-led pediatric physical therapy sessions. This teaching innovation was created in the pediatrics course for second-year DPT students. 2 lab sessions are dedicated towards students preparing, planning, and carrying out a live pediatric physical therapy treatment session. During the first lab, students receive patient background information that also includes family goals related to physical therapy. Using this information, students collaborate and plan a pediatric treatment session with interventions to help improve the child's functional status. During the second lab, families arrive on campus with their children for the students to lead and complete the physical therapy treatment session. This treatment session is an innovative idea in that it provides experiential learning for students while on campus prior to going out for their clinical rotations in their third year. Throughout the curriculum, students learn many manual skills that they will use throughout their career and are able to practice those skills on peers in labs, as well as perform them on standardized patients during practicals. In pediatrics, our instruction is often limited to just discussions of case scenarios and watching videos in class. And while videos can only take us so far, this lab allows students to be able to apply the concepts learned in class in a clinical setting and gain some hands-on experience on a pediatric client. While the DPT curriculum does include integrated clinical experiences, a pediatric setting is not required, which leaves some students without any type of exposure to a pediatric patient before graduating. All who participated in this lab were positively impacted, from the students, children, parents, and instructors. The children who attend the lab are children with conditions that do warrant physical therapy intervention, and by attending the lab, they receive the benefit of additional physical therapy services that are supervised by licensed physical therapists. On this slide, I've included quotes from a few students who have expressed how rewarding this opportunity was for them. The impact of this innovation was students learning how to use decision-making and clinical reasoning skills to modify their plan of care based on the child's response. Included on this slide are direct quotes from students from a reflection completed after the lab experience. This lab experience aligns with each one of ATSU's core professional attributes. For critical thinking, students are able to provide a rationale for the evidence-based treatment interventions that they select. In addition, they are able to progress or modify these interventions based on the patient presentation or response during lab. For interprofessional collaboration, the students work and collaborate in small groups while they deliver family-centered care with the patient's and family's goals in mind. For cultural proficiency, students demonstrate cultural sensitivity as each family has a different dynamic, values, and beliefs. For social responsibility, the students practice according to the PT Code of Conduct and also to a standard that is fitting for ATSU's mission. For interpersonal skills, the students communicate and practice active listening with the child throughout the session, as well as providing the family with feedback and closing the session as if it were a real pediatric session. In addition to their interpersonal skills, the students practice documentation for the treatment session, as well as self-reflection for professional growth. This lab experience requires a lot of planning and preparation, however, is not impossible to implement. The greatest challenge is in recruitment, as we must work around family schedules and, depending on the age of the child, a school schedule. Labs and equipment are available to faculty and students, so the cost was minimal, and the only cost was that for snacks and refreshments and a small reward for completing the treatment session. I believe this idea is able to be adopted by all programs, and I believe it has a potential for growth for an interprofessional educational opportunity for collaboration between programs. Thank you so much for your time and consideration, and I hope that you choose to select this idea as the 2025 Innovation in Teaching Award.